States. Senator Cassidy.
Hey, Mr. Secretary, thank you, sir. We had kind of thank you for the dialogue before the meeting. We had told you we're concerned about how do we know the people at HHS are working. So let me put this picture up. This is a picture taken at 10:40 a.m. last Monday at an HHS headquarters. It's like empty. And then we could have pictures of other parking lots that are similarly empty. Wow, the building's empty. If there's no cars, the building's empty. So we just appropriated $3 billion. Well, first, tell me this, please. Can you give a breakdown of how many full-time employees are at their desk in one of these buildings every day?
Senator, when you take a look at the workforce at HHS, and we're close to 90,000 throughout the country, and working in various parts of the country, some here in headquarters. By the way, headquarters, we have an underground.
I got limited time, so this may be misleading. So tell me, of what percent of the employees are at their desk, full-time employees are at the desk on any given day? And I don't mean to be rude, it's just so limited time.
No, and I appreciate that. And our folks are working full-time.
No, but how many are at their desk as opposed to being at home or someplace else, a coffee shop or whatever?
Yeah, what we make sure we care about is that they're performing and they're delivering, and that's why.
Well, that's not really answering my question, because I know the best practices now in many industries is to bring people back in. So is it 5%? Is it 10%? Is it 1%? How many folks are actually sitting at their desk in a government building when they are working full-time every day?
And we have folks who, as they're working full-time.
So it's kind of not a... Clearly, sir, you don't want to answer that question. And I don't mean to be rude, but you don't. And that kind of begs that the answer may not be flattering. When CMS put out a request for employees as regards to the complex drug negotiations that was in a recent bill, the posting offers generous telework policy. What does generous telework policy mean? If somebody hired into that program, how many days a month would they be expected to actually be in a government building as opposed to wherever they wish to be?
And Senator, that would depend on the workers. Some people have never left their job, even during the height of the.
I'm not speaking about leaving their job. I'm speaking about being at their desk, and not speaking of some, but of a percent, if I may, because anecdotes are not data.
You're limiting the scope of what we do. We have investigators who never sit at desks.
But say, take somebody who traditionally would have been at their desk before the pandemic, please.
And depending on the work that has to be performed, they will be in the office at times. Sometimes they may be in the field. But what's
Can I ask just for the record, because obviously it doesn't seem, Mr. Secretary, you're prepared to answer that question. But for the record, can you give us a percent of the actual workers who are full-time, who would be expected to be at their desk, not an inspector in Louisiana, but someone else, if you can give it that for the record?
We can follow up, Senator.
Can the agency provide us VPN data or some other measure of accountability that shows that the people truly are working from home?
We can certainly show you that they're performing. The fact that 700 million shots have gone into the arms of Americans.
But do you have that VPN data? Because initially when the pandemic started, we saw VPN data that showed a double-digit number of employees were not turning on their VPN every day. And so it suggested they were not accessing emails, for example. So is that data still being collected? If so, can you share those results?
I can try to get back to you on that.
Now, if you live in the D.C. area, you get a work differential. So you get a little bit more. Your cost of living is more. So is someone who is in this building with an empty parking lot, is someone in that building not knowing where they are currently working, are they still getting a cost of living adjustment as if they are working in Washington, D.C.?
Yeah, first I have to tell you, Senator, that is not the headquarters of the HHS, of the Department of HHS.
It is CMS headquarters.
Oh, okay. So what we can get back to you on is someone working. As I said, we have been coming in, day out.
But
performing day in, day out.
But let's assume that, because I've heard from people within the agency that in reality people are only required to come in one day out of a month. And this has been something we've heard from CDC along those lines, but I've also heard from somebody who's working at CMS. Now, I assume that you have a global policy because you have the same union negotiating for all of HHS. So, it seems to me as if it's going to be the same policy wherever you are. So my question is, if you are working from home consistently, and originally you were based in D.C., are you still getting a cost of living adjustment even though we frankly don't know where you might be flying in one day a month but living in West Virginia?
Again, Senator, I'm not familiar with this statistic that you're throwing out that says
But is there a cost of living adjustment for people who are taking advantage of generous telework?
there is certainly a cost of living adjustment for folks who work in high-cost areas.
Even if they are teleworking?
If they are performing their work, they are entitled to receive a cost of living adjustment if they work in a high-cost living area.
And when you define work in a high-cost living area, do you mean telework? I mean, they could be in, their VPN could show them in D.C., but they could be in West Virginia. So are they getting paid as if they are living physically and showing up every day and parking in that parking lot every day in the D.C. area?
So you would have to take a look at the particular job description to find out what type of work is done and where they are located to be able to make that determination.
I yield.
Thank you, Mr. Chairman, and Mr. Secretary, thank you for being here. And I am so grateful we have the Alzheimer's volunteers here. We have a great group in Tennessee. And there's some back there. Love seeing them. But you know, Mr. Secretary, the budget that you brought to us, it is full of things that get in the way of research. It would prevent new drugs and therapies from coming to market. It would weaken those IP protections. And it would expand big government, and it's something that does cost us some concern. I want to return to the issue of telework. I know that Senator Cassidy discussed this with you. Adding to the list of how many HHS employees are working telework, I would like for you to identify the essential and non-essential components of that list of those that are teleworking. And also looking at you and your team personally, when you look at telework, how many days have you spent in California during COVID-19?
Thank you, Senator, for the question. With regard to my status, I know that requests have been made for my schedule, and we will try to provide as much information
Yes,
as we can.
I think it would be great if we were able to get the schedule for you, your security detail, and the records expense reports so that we could see how much. The reason this is important is because you are overseeing an agency that is the equivalent of 1/10 of our nation's GDP. And I think that it is vital that you be on site in overseeing that department. So can you even ballpark how long you were in California and how often you were absent?
I don't get to California very often. When I do, it's usually because I'm doing work and I would travel.
During the pandemic, because I think it's important that during the pandemic that you were there.
Not often.
I want to read this back to you. 2019, talking about the border crisis, you said of President Trump, and I quote, "And to say that it's an emergency, and then within 24 hours, having said it, go off to Florida to your Mar-a-Lago resort when you think there is a national emergency. I think all the evidence, including what Donald Trump says and does, proves this is no national emergency," end quote. So by your own standard, you would equate COVID to not being a national emergency if you're spending those hours in California and being absent from the headquarters. It's time to get people back to work. Faith-based organizations. We have 8,000 faith-based organizations across the country that are irreplaceable members of the nation's child welfare system. Senator Ossoff and I are going to do some bipartisan work at Judiciary Committee on these issues. Tennessee relies heavily on faith-based agencies for services like foster care, adoption, different child and family services, and the recruitment of those adoptive families. Now, under your leadership, one of the first actions that HHS took was to rescind waivers issued by the previous administration, which allowed faith-based groups to place children with families in accordance with their sincerely held religious beliefs. The president's budget now proposes to combat sexual orientation and gender identity discrimination by penalizing foster care and adoption providers for operating in accordance with their tenets of faith. So with nearly 400,000 children in the foster care system, would you not agree that placing those kids in loving homes is a greater priority than advancing an agenda?
Senator, thank you for the question. There is no doubt that being able to place any child who's in foster care in a loving home should be our top priority. And we want to make sure that that's always possible. We want to make sure laws are not violated that would prevent that child from going to a loving home.
Let's do this. Let's have you submit how many potential foster and adoptive homes would be forced out of the system if the president's budget were put into effect on that issue. I want to go back. I know Senator Menendez talked to you about the Office of Refugee Resettlement, and this department is responsible for the care and placement of unaccompanied children who come across the U.S. border, correct? And are you aware of the recent New York Times article that really reported on the large numbers of unaccompanied children who are being placed with exploitative sponsors and working long hours in dangerous conditions?
I'm aware of the fact that a number of children have been reported to be working in ways that are violating our law, but I'm not aware of the situation you mentioned about being placed in exploitative circumstances. So if you could clarify that a bit more.
I will be happy. Mr. Chairman, I'd love to submit that article for the record.
Without objection.
That is wonderful. Thank you for that. Now, the agency, the Times reported that under the Biden presidency, the agency cannot find 85,000 children, and that the agency lost contact with a third of the migrant children that are coming into the country. So I'd like to know what you're doing to find the children and what you're doing to make certain that these children are not being trafficked.
Senator, first, those statistics that you've mentioned, as I said previously in regards to another question by one of your colleagues, those are unfamiliar to me. I have no idea where those statistics come from, if they're based in reality or not. And we do everything we can to make sure any child, before we allow them to be released to a sponsor, that sponsor has been vetted.
Okay.
The vast majority of these children end up with a family member, immediate family member, as a placement. So some of those statistics that are being thrown out there that don't seem to be based in fact really would go contrary to what actually we've done.
Okay, my time is over, but let me tell you, we have to get this thing straightened out. At any time you had 10,500 children under your care, the money works out to about $1,400 a day to take care of these children, and you can't find these children. We have to get it straightened out. Thank you, Mr. Chair.
Senator Johnson, you're next.
Thank you, Mr. Chairman. Secretary Becerra, welcome. Do you believe it's important that we understand how the coronavirus originated?
Absolutely.
Is there somebody in your agency, your department, that is spearheading the investigation to determine that?
We have done taken a number of initiatives to try to move forward there, including having our OIG take a closer look.
So
but
you're saying it's the OIG? I mean, is there somebody within the department outside the Inspector General that is spearheading this? Somebody in charge?
CDC, NIH are also doing a scrub. We're all trying to get as much information. The difficulty is that we're not getting a lot of cooperation from some of the sources externally that probably can give us.
Let's talk about lack of cooperation, because I'd say the same thing's true in terms of cooperation out of the agencies. Do you believe the public has a right to know how the agencies are spending their money and how they're operating?
The public does have a right to know, yes.
There's two primary methods for that. You have FOIA, Freedom of Information Act requests, and then you also have congressional oversight. Would you agree that FOIA is generally subjected to more redactions than congressional oversight would be?
I wouldn't say that, but we do have to be careful what goes into the public domain. We're respecting confidentiality and privacy.
I understand. There are some exceptions that are very explicit out there. That a lot of them make sense, but I would argue, I think many people do, that congressional oversight really is not subject to those same redactions, particularly when we have security clearances and we can take a look at classified information that is appropriately redacted under FOIA. Let me give you a couple examples. We requested these documents, by the way, in June of 2021, under a FOIA request, court ordered 4,000 pages of different documents, primarily emails of Anthony Fauci, were produced under the FOIA. In September 2021, that month we had 5 members of Homeland Security Governmental Affairs ask for those same pages unredacted. And there's a law that says you shall turn that over to us. In September 2021, we started working with HHS to produce those documents in an accommodated process. So we narrowed the 400 pages, 4,000 pages down to 400 to get those things unredacted. They weren't handed over to us. What we did, we were allowed to read them 50 pages at a time in a reading room and take notes. Some productions we did get, for example, we got this document dated February 4th between Anthony Fauci, Jamie Farrar of the Wellcome Company, and Francis Collins. You see the redactions here. This is the same document produced under FOIA without the redactions. So now we know what was redacted, and this was redacted, by the way, under B4, which is trade secrets. One thing that was redacted here is Anthony Fauci saying, serial passage in ACE2 transgenic mice. In other words, humanized mice. They were talking about, Farrar is writing to Francis Collins, remains a very real possibility of accidental lab passage in animals to give glycans. He said that Eddie thinks it's a 60-40 lab side. Farrar said he thinks it's 50-50. Again, this is February 4th. There's nothing to do with trade secrets in that redaction. Another example. This is February 2nd. Again, this is when they're understanding that they funded this dangerous research, and now they're into cover-up mode. Here's what we got in our production, the heavy redactions. This is what was released under FOIA. Now, this was released under the B5 exception, which is privileged information within or between agencies. Again, this is with Jamie Farrar of the Wellcome Trust. So we had redactions with, privileged information. It didn't apply, and we still had it redacted. I don't have time to get into that. This is completely inappropriate. And by the way, you have produced 350 pages to us in the reading room. For over a year, we've been asking for the last 50 pages. This is what the 50 pages look like, okay? Now again, I would argue congressional oversight should not be subject to the same redactions that were applied under a FOIA request. I'm asking you, will you commit today to provide our oversight? And Senator Paul is on this now. Again, we had 5 members of Homeland Security Governmental Affairs under a law that says you shall provide this. Will you commit to provide us the last 50 pages of communication between Anthony Fauci, Francis Collins, Jamie Farrar, as relates to the origin of the coronavirus? Will you commit to that?
Senator, I absolutely will commit to make sure we follow up with you on your request to get some of that information. Again, this is in compliance with the law that you receive the information. I don't know what particular statute with regard to disclosure was applied here, but you are absolutely entitled to the information that by law a member of the Senate or the House should get.
Again, you're not complying with the law because you're redacting things, for example, under deliberative process between and within agencies, and it's communication outside of the agencies with the Wellcome Trust. Again, these redactions are not complying with the law. So again, I'll appreciate, we will follow up with you. I expect to see the unredacted 50 pages very soon.
We can comply with the law, Senator, but we absolutely will make sure we follow up with you.
Florida, Mr. Stubbe is recognized.
Thank you, Mr. Chairman. On January 30th of this year, a Cochrane report was released, and it found that for, and I quote, medical or surgical masks, and in a separate analysis for N95P2 respirators, and I quote again, compared with wearing no mask in the community studies only, wearing a mask may have little to no difference in how many people caught a flu-like illness or COVID-like illness. Are you aware of the analysis that I'm referencing?
Congressman, I've heard of a lot of analysis. I know at the end of the day, wearing a mask has helped keep Americans alive.
Well, not according to the Cochrane. The medical and surgical mask analysis reviewed 9 studies in over 276,000 people. The N95P2 analysis reviewed 5 studies in over 8,400 people. But then on March 10th, Cochrane put out a statement noting that their analysis was actually inconclusive and that the exact quote from their analysis that I just read was, quote, misleading, after they had just found all of that based on all those studies. So it's clear that somebody in the administration or somebody somewhere influenced Cochrane's attempt to backtread from their previous findings 3 months prior. So my first question is it true that you had conversations with Cochrane regarding their January findings after their report was released?
If your you refers to me, that's not true.
Okay. Did anyone acting on behalf of HHS contact Cochrane about their January 30 findings after their report?
Best I know, no, but I can try to find out if you'd like.
So would you be willing to give any documents or correspondence that anybody in your agency had with Cochrane between January and March 10th of this year?
We will provide to you whatever documents are disclosable by law.
Okay, I'll put that into a letter. Is it true that someone from HHS or the Biden administration pressured Cochrane to change or back away from their January 30 findings?
I know nothing of that ever happening.
So you're not aware, but you're saying that you're not aware that somebody in the agency may have had conversations with them?
As far as I know of no one in the agency who just engaged in that kind of a conversation.
And your testimony here today is that you'd be willing to provide correspondence between anybody in HHS with Cochrane after January of this year, after the findings?
We are prepared to provide you with whatever documents legally you're eligible to request.
Okay. Has HHS ever contacted social media platforms such as Twitter or Facebook to pressure them to remove statements about COVID-19 that the administration didn't want circulated?
I believe now you're making reference to some lawsuits that sort of make those kinds of allegations, but I can say to you that I'm not aware of anything like that, at least not for me.
So you've not had any conversations with any social media platforms about anything related to COVID and the information that they're putting out to the American public?
Other than perhaps using some of these platforms to put out information.
So you have had conversations with social media platforms as it relates to putting out information?
I have put out information on some of these social media platforms. I have not had conversations with the representatives or the leaderships of these platforms trying to influence them to do one thing or the other.
So your testimony is you put things on platforms, but you have not had conversations with executives or anybody at Twitter or Facebook or otherwise?
Now you're stretching it. Have I ever had conversations?
No, I'm following up on your testimony.
Okay, so the answer is there may have been occasions for me to have conversations with executives from any of those media platforms on any number of subjects.
Did Surgeon General Vivek Murthy participate in meetings with White House officials and social media company officials discussing what information should be hidden from the public?
I suggest you ask Surgeon General.
Are you aware of any conversations that they had?
I know that he has conversations with lots of entities and individuals, but I couldn't specify if in this particular case.
I'm asking if you are aware that he had conversations with those social media platforms.
I am not aware.
Mr. Chairman, I ask unanimous consent to add to the record the Cochrane Library analysis, physical interventions to interrupt or reduce the spread of respiratory viruses, and the Cochrane 3 months later statement on physical interventions to interrupt or reduce the spread of respiratory virus.
Thank you, Chairman. My apologies for coming in late. I was balancing the budget, so I was delayed.
Congressman, you can go back and balance the budget. That's okay with me.
I know. Well, listen, my constituents would say the same thing.
Amen.
Quit talking, go take action to save this country from a debt crisis. In all seriousness, both parties have made their contributions to this runaway deficit and unsustainable debt trajectory. I say that, Mr. Secretary, because I'm not giving any party a pass on it. But before we put out our budget and our long-term vision and the values reflected in that budget framework, we are unpacking President Biden's budget. And there's a lot to unpack because it's the highest levels of sustained spending, taxes, and deficits in the history of the United States. And this, after a lot of spending, a lot of inflation, soaring interest rates, and an economy that's spiraling downward. So I'm looking for a change in direction. I'm looking for a course correction, and I see nothing but doubling down on the policies that are driving the deficit spending and the debt. and very little consideration, in my opinion, for our children and grandchildren. Because we're really borrowing on their backs and their future to pay for this stuff. When it comes to healthcare, which is a big driver and one that we all have to roll up our sleeves and figure out how do we lower cost of healthcare across the board, I was very concerned about the expansion of Obamacare subsidies in the IRA, about $65 billion worth, and now in the president's budget proposal, I'm sure you're aware, $185 billion in more expansions. Here's the first rub for me. We're expanding to people who already have insurance, as I know you're aware. In the IRA, we only cover 1.7 million people who were uninsured. The rest of the folks that were covered, who were making, by the way, upwards of $200,000, $300,000, already had employer-based insurance. So we're spending taxpayer monies to subsidize people that are making hundreds of thousands of dollars a year. In this second round, I've read, I haven't confirmed this, that people making upwards of $600,000 are getting ACA subsidies. Now, that doesn't make sense in any world to me unless the intention is to move our country to a universal care system, to a single payer system. Is that the real, it's okay, that's a position, it's a view of the world and government's role, it's not my view, but is that, and I'm not being cute about it, is that the intention of these expansions of Obamacare to people making hundreds of thousands of dollars who already have insurance? Are you trying to move the country to a single payer system? And I yield for the answer, and I appreciate your time.
Congressman, thank you for the question. I have to start by saying that your depiction of the president's budget, I cannot agree with. Your numbers that you mentioned, I don't know where you got them. I know nowhere where anyone has ever mentioned that someone making $600,000 would qualify for Affordable Care Act coverage with subsidies. But what I can tell you is this: the president, in his 2 years in office, has reduced the deficits each year. The president's budget proposal that he put forward to Congress also reduces the budget deficits moving forward over 10 years. And so I'm not sure where you're getting those numbers, but the president's numbers are out there, whether it's Office of Management and Budget in the executive branch, or whether it's the Congressional Budget Office, CBO, which does the scoring for Congress. I remember that from 24 years here. Both have said that the president's budget would reduce deficits.
Well, I know my time's expired, and so I don't want to, I'm not going to abuse that. I'm just going to say we have a wildly different opinion about it, and but I respect your answer and appreciate your time. So I yield back, and thank you.
Mr. Sec, the gentle lady from New York, Ms. Malliotakis.
Thank you, Mr. Chairman. Thank you, Secretary, for being here today. You know, this administration talks a lot about setting what I would call innovation-killing price controls. But one of the things I do want to talk to you about where I think we could really work together on access and affordability of prescription drugs would be PBMs. Okay? Obviously, our pharmacy benefit managers, which it's troubling to me that the three largest PBMs actually control 80% of the market. There's no transparency. They are making a lot of money by keeping rebates instead of passing them on to consumers. They exclude drugs from their formulary, and they are dictating what their competitors are making, right? And they are crushing my small mom and pop pharmacies. Here you have PBMs that are also the insurer, and then they're the pharmacy, and they're controlling everything in terms of pricing, okay? For example, right, CVS Caremark, they also own the insurance company Aetna, and then they own the pharmacies, CVS's all over the country. Now, do you think that is a problem?
Congresswoman, PBMs have, you know, no one knows everything they do. We're surprised sometimes when we see what comes out. and there absolutely has to be more transparency in the way they do business.
Well, the FTC recently announced their plans to probe the largest 6 PBMs in the U.S. And with the role that PBMs play in Medicare drug pricing, can you explain why HHS has not launched its own investigations, is not pushing for more transparency in order to shed some light into this very opaque process?
Oh, Congresswoman, let me assure you, we are working in this space. You may not have seen a particular rule come forward, but we are absolutely working in this space. And if you're interested, we would love to work with you because this is an area where reform is needed.
You say you're working in the space. How so?
Some of the work that we're doing is in the process of, we're trying to get some rules ready that would deal with some of this. At the same time, we're trying to avoid some of the lawsuits that are being filed. And what we're trying to do is continue to give consumers access to some of these prescription drugs at the best cost we can get them for them. And it is difficult, but we are trying to do what we can, working within the constraints we have within the laws, because we can only go as far as the authorities you've given us.
Well, I think actually the administration has, I think, a unique position to be going after the PBMs, actually. And you mentioned rules. You said, did I see a rule? And then you said, well, we have some rules coming out. So, I think that needs to be clarified there that maybe you haven't done anything just yet. But I'm just trying to understand why HHS seems to be sitting on the sidelines and giving PBMs, free rein, considering the role that they're playing, particularly in Medicare prices, but also just pharmaceutical drugs for all our constituents who are paying just way too much right now. And it is because of the games that they're playing and the lack of transparency.
Yeah, I can guarantee you we are not sitting on the sidelines. As we talked about insulin, it's $35 a month. We're
that's a price control. That's not going after the PBMs.
But we're affecting the price of drugs. We're making them more affordable, and that's what counts. And ultimately, the work, whether on PBMs or in making sure we can negotiate prices for drugs, it's to make sure consumers, Americans, get better prices for their medication.
I've run out of time. Thank you.
Thank you, Mr. Chairman. Thank you, Mr. Secretary, for appearing today. I want to ask you about a New York Times article dated February 25, 2023. The headline, "Alone and Exploited Migrant Children Work Brutal Jobs Across the U.S." Arriving in record numbers, they're ending up in dangerous jobs that violate child labor laws, including in factories that make products for well-known brands like Cheetos and Fruit of the Loom. The article talks about migrant children have been coming into the United States without their parents in record numbers, are ending up in some of the most punishing jobs in the country, a New York Times investigation found. It says 12-year-old roofers in Florida and in Tennessee. The article goes on to say that the number of unaccompanied minors entering the United States climbed to a record 130,000 last year, 3 times what it was 5 years earlier, and this summer is expected to bring another wave. The federal government knows they are in the United States, and the Department of Health and Human Services is responsible for ensuring sponsors will support them and protect them from trafficking or exploitation. But as more and more children have arrived, the Biden White House has ramped up demand on staffers to move the children quickly out of shelters and release them to adults. Caseworkers say they rush them through vetting sponsors. While HHS checks on all minors by calling them a month after they begin living with their sponsors, data obtained by the Times show that over the last 2 years, the agency cannot reach more than 85,000 children. Overall, the agency lost contact with a third of migrant children. Mr. Secretary, is the New York Times correct that HHS cannot account for 85,000 migrant children in the U.S.?
Congressman, no, they are not.
Okay. What is the number then, Mr. Secretary?
You have to understand the responsibilities that HHS has. We do a follow-up check on these migrant children by contacting the children and their sponsors, but our authorities that Congress gave us go towards caring for the child while they are in our custody. Once they are in the custody of those sponsors, we don't have jurisdiction over the children. And so for the New York Times to say that we lost contact with them, it's not that we lost contact. We try to make an effort to follow up with them, but they're under no obligation to respond to us, neither the child nor the sponsor. And so the New York Times could have done a little bit more homework to figure out what HHS responsibilities truly are.
All right, let me ask this, because the article specifically says the agency cannot reach more than 85,000 children. You're saying that's an incorrect statement.
That's an incorrect statement.
And you do or do not know what that actual number is?
I can tell you the number of children that we have placed in the care of sponsors, and every one of those children we follow up with.
What is the number of children that you don't have contact with?
Congressman, as I just explained, we no longer have jurisdiction over the children once they are placed in the care. You didn't give us the authority to keep in contact with those kids.
You don't know what the number of children is that you don't have contact with, correct?
We make contact. We try to make contact with every child that has been in our care that we place in the hands of a sponsor.
Thank you. My time's expired. I yield back.
Representative from California, Ms. Chu, Pennsylvania, Mr. Kelly.
Thank you, Mr. Chairman. Mr. Becerra, good to see you again.
To see you.
You spent a little bit of time in between. I just wanted to ask you something, because I've been in the private sector my whole life, and I'm trying to figure out how you put all these pieces together. You have 83,000 employees, is that right?
About there, yes.
That's a big payroll. That's
Yes.
a big payroll. So, and approximately 4,000 of these employees are based at the CMS at their Woodlawn, Maryland headquarters. So how many of these employees are working today in person, actually in person?
Congressman, the HHS workforce went back to full-time work from the get-go. We were able to use telehealth during COVID, and now that we're beyond that, we're able to continue the workforce at full-time. And you've heard some of the dramatic results of a workforce that has continued forward. Some have never left coming into the office or coming into work. Others are taking advantage of some of the flexibilities that we provide so they could come in on some days and work from a different site other days.
Yeah, well, I have a photo. This picture, well, you say these people are at work. This is last Monday, okay, March 20th. This is at 10:30 a.m. in the morning. It's a beautiful parking lot. There's everything on there except cars. I don't know how your people get to work, but this is your office building, and you're telling me they're working full-time. They must be working full-time from home or some other way of doing that. I just don't understand that. You know,
Congressman, that's
this
not
year,
my...
this year, no, Mr. Secretary, this is a picture. You've seen it before, and you know what it is.
Yeah.
And then we request another $18 million in rent compared to last year. So when you look at the people that fund all this stuff, and these are hardworking American taxpayers, I like the talk that goes back and forth about what we're going to do for sick people, how we're going to shore this thing up, how we're going to do this, how we're going to cover all this stuff. At the end of the day, there's only one person signing that check, and that is the taxpayer. So why should the American people be expected to pay rent for an office building that isn't even being used? There's so much waste in this government. There's so much fat in this government. It is impossible. I'm embarrassed to go back home and tell people this is the way it's supposed to work. This is not the way it's supposed to work. This is crazy stuff. Nobody would look at this as a business model and say, hey, yeah, good idea. Let's pay a lot of rent. Nobody has to be there, but we'll pay rent. Now, you said you're going to get the whole workforce back to work. They're actually going to show up in person in their buildings and actually work. And I'm not talking about being on these little things we've set up and all the little pictures show up and people get a chance to talk. I don't know. I think that they're so inefficient right now. Are you telling me, and I want to know this seriously, do you ever expect to be back fully at work, at their desks, in their buildings, doing the work for the American people?
Congressman, we are fully at work, full-time.
Well, this was a national holiday then, probably, right? This is March 20th.
You know, Congress, I don't even recognize that photo. That's not certainly a photo of my office building.
Oh, okay.
Maybe a parking lot of a building that HHS has employees in.
Yeah, well,
I doubt that you can say that speaks to the work that's being done.
I will tell you this. This is Woodlawn, Maryland, your headquarters. If this is your headquarters at 10:30 in the morning on a Monday morning on March 20th, there's something that doesn't match with what you're telling me. I don't want to keep grilling you on this because I'll tell you what, both you and I pay a portion of whatever it is that we earn to fund all these things. I just am appalled at the way this government works. There's so much fat. The things that we have to do, yes, do them. But you better learn how to work within a budget that makes sense. I can't take this home and tell my people that I represent, you know what, listen, it may not make sense to you, but it doesn't have to. This is the way we run our government. This is your parking lot in Woodlawn, Maryland. That's where it took place. It did not take place someplace else.
But you cannot say that the folks that work in that Maryland site, if there is a site there, are not working.
I don't know. You know what? I would love to go sometime. I would even like to go to the IRS and see those people working at their desk, and I'd like to see your people working at their desk. 83,000 people getting a paycheck from the American taxpayers. And what we say is they'll work part-time. 30 hours a week is part-time. I would just say this government has a lot of people that are part-time. I think I yield back. Listen, I do appreciate your service because I like you personally. You know that. But I do, more than you, I like our taxpayers, and you're the guy in charge. It's a heavy lift. My God, 83,000 people.
They're working.
I know, I hear what you say. I'm just saying the pictures don't reveal that they're working, and I think the American people deserve an answer.
I'll bring you some pictures next time.
Okay, very good. Thank you. I'll go here with you.
The gentleman from Connecticut is recognized, Mr. Larson.
Thank you, Mr. Chairman.
Mr. Chairman, thank you, Mr. Secretary, for being here. I want to follow up on that because it bugs me. I thought it was actually 30 drugs that the CBO estimated would not exist, and plenty of other estimates have much, much higher. We've talked to industry, we've already seen the dollars drying up from investing in what they would call higher risk investments. That would definitely be Alzheimer's. So what drug companies are going to do because of this price cap rule, what they're going to do is they're going to invest in quote unquote safer investments. So the drug companies will be fine. They'll be fine. You know who won't be fine? Alzheimer's patients who want that cutting edge drug. That is a fact. And you guys can sit there comfortably in your position on this because you know that we can never prove a counterfactual because there's another element of history that we will never know about. And it's very, very frustrating. But I want to talk about your budget. So one thing that concerns me, and the chairman mentioned it, is the president's budget mentions climate change 42 times, mentions fentanyl twice. What's the leading cause of death for adults age 18 to 45?
Congressman, I would mention that while we may have mentioned the word fentanyl, we put $10.9 billion more than I think any administration has to fight overdose.
I appreciate that. I'm not sure what that money's going towards, but
we can outline
it's opioid. I mean, the answer to my question, you didn't answer my question, but it's opioids. I'll just answer it for you. It's opioid overdose, right? Most of that is fentanyl. We lose about 100,000 people or more to opioid overdose. Almost 80,000 of that's fentanyl directly related. You can't even compare that kind of number to climate change. Not even close. I mean, if we want to actually compare, let me ask you actually, I mean, is HHS in charge of regulating carbon emissions? Am I missing something here? Why do you guys have an Office of Climate Change and Health Equity funded in this budget?
Congressman, I think it's a proven fact that the impacts of climate change are affecting the health of Americans and people around the world.
How have you quantified that?
Excuse me?
How have you quantified that?
I can get you some of the research that's been done. I can show you some of the communities that have been affected. We can do any number of ways to quantify it. You can let me know.
I have a way of quantifying it. Here, I'll help you out. So since 1900, deaths due to nature have plummeted by over 90%. Actually plummeted over 70% just since Biden took office. So weather accounts for somewhere around 0.07% of worldwide deaths, 0.01% in the United States. And that's by the way, with the population increasing like tenfold. So there's a completely negative correlation there, and we're pretending like it's a crisis, and we're scaring people to death about it. And you're telling hospitals that they should be going to net zero. Of all of the locations in America that I would want to have reliable energy sources because people are on life support, I think hospitals would be one of them, right? And if hospitals go to net zero emissions, what kind of effect is that going to have on our temperature in 100 years?
Hospitals, one of the major, the healthcare sector is one of the major contributors to pollution in the world.
What? How do you quantify that?
We can get you the information that shows that the healthcare sector, because of its production of lots of different and uses of lots of different chemicals, the fact that it's a very widespread industry, it does have a major impact on the climate.
So you're just going to get rid of these chemicals? Why don't we get rid of plastics too? The plastics that are used for medical devices that save people's lives. Is that a good idea?
I think most people would say to you that where there is a use for plastics, but we don't have to have so much plastic in the world that it's causing major degradation of our environment.
What you're saying is terrifying. What you're saying will harm people. I mean, high-quality plastics are used in an extraordinary way for cutting-edge medical devices. They're used in everything in a hospital. And what percentage do you think our healthcare sector contributes to overall carbon emissions? You said it was significant. You said it's one of the most significant. So what's the percentage? Do you have a ballpark?
Of the industry of the sector?
Yeah, you just said the healthcare industry is one of the biggest contributors to carbon emissions. So do you have a ballpark percentage of what that might be?
I don't have it in front of me, but I can get you that information.
I think it's probably less than a percentage point. I mean, I see these numbers all the time, especially on this committee. Transportation's a big one, right? Power production's a big one. The healthcare sector is a big one. That's what you're saying?
The healthcare sector is a big one.
How much money are you guys wanting to spend on this in your budget?
Spend on what?
On this office.
It's a small fraction of the entire budget.
Uh-huh.
I can tell you the exact amount if you give me time to look through the book.
I only have 7 seconds, but thank you. I yield back.
The gentleman yields back, seeing no one on the Democrat side. The chair recognizes Dr. Dunn for 5 minutes for questions.
Thank you very much.
Vice Chair Collins. Thank you so much, Madam Chair. Secretary Becerra, welcome. You may have noticed this week that there is a sea of purple in Washington, D.C., and that purple is worn by advocates for those who are suffering from Alzheimer's disease, are afflicted with it themselves, or are caring for someone, or who have lost someone to this devastating disease. I know that's true of both your family and my family as well. So it is with great disappointment that the CMS is blocking and acting as a roadblock for patient access to drugs that could be very helpful to these patients, particularly in the early stages of this devastating disease. I just do not understand CMS's misguided and outright unprecedented decision to not cover a whole class of Alzheimer's drugs. It is not CMS's job to second-guess the drug approvals of the FDA. That's not what CMS is supposed to do. So last month, I led a bipartisan letter signed by 20 senators, bipartisan, asking HHS and CMS to reconsider the restrictive coverage requirements in light of the FDA's accelerated approval. And I'm disappointed that I haven't received an answer to that letter, which was sent more than a month ago. I'm also perplexed why CMS does not respond to a letter from the American Academy of Neurology that was sent on February 2nd that says that the questions CMS has raised have been answered in a massive, successful clinical trial and a peer-reviewed publication reviewing the results of that trial. And that was phase 3 data. So CMS promised to expeditiously look at the data, and yet we just get silence. Furthermore, 200 Alzheimer's researchers have also written to CMS and said there's no question but that this drug should be allowed for patients who are receiving Medicare. It's not enough, as I believe Senator Capito pointed out earlier, to say you can get it if you're in a clinical trial. That is of so little help to states like ours, where there may not even be a clinical trial going on, or there may be one that's far away from most of the people in the state. So I'm just asking you to tell CMS to let this drug be used and let people get access to it when the patient and his or her clinician agrees it is the appropriate treatment. That's all we're asking.
Senator, I don't know if there was a particular question other than to ask CMS, and certainly CMS has had to review this. Many of the people who are at CMS who went through this process have also had loved ones who've gone through illnesses like Alzheimer's. I myself, I mentioned this, and my wife have gone through this. There is no doubt that we want to get to the types of life-saving treatments that Americans can benefit from. The difficulty here is that we have to remember that the process that the Food and Drug Administration uses is different from the process that legally that the Centers for Medicare and Medicaid Services must use to make their determinations. And while it may not make a lot of sense to folks, and it is, you have to go into the weeds to understand the distinction, there is a legal distinction. And CMS has to remain consistent in the way it treats any drugs. And so I will absolutely make sure I take back the information. CMS has said that as soon as they collect the evidence that lets them believe that they now can move to a different level, a different stage, they would. If FDA were to give approval, standardized approval to the drug, they could then make further progress in broadening the scope of access. But CMS is trying to use the standards it has in place to legally follow its obligations in when it makes a determination for Medicare.
Well, I would just suggest to you that CMS now has all the evidence that it can possibly need to grant that approval, given this clinical trial, which was considerable and produced good results, and the 200 researchers. CMS needs to stay in its lane. FDA is in charge of drug approval, not CMS.
But Senator, if you'll allow me, even FDA is asking the drug manufacturer to continue to provide evidence of the efficacy of the drug. They have not said with finality that this drug is safe and effective. They're still waiting for more evidence to come in.
Well, I don't know what more, I know my time's expired, but I don't know what more evidence you could need than a stage 3 clinical trial. And it's just extremely frustrating, as is the fact that the president's budget does not provide additional funding specifically targeting Alzheimer's research. And that's something I hope we can correct. Thank you.
Thank you. Thank you. Next, we have Senator Hyde-Smith.
Thank you, Chair Baldwin and Ranking Member Capito, and thank you, Mr. Secretary, for being here today. The concerns in Mississippi are very similar to many other states. Many hospitals are experiencing unbelievable financial and workforce restraints, and many have forced to cease services in order to keep their doors open. There's a hospital in the Mississippi Delta that has had to stop any OB, intensive care units. All of that has to come to a close for them just to offer, primary care. But it's very vital because the closest OB is like 45 minutes to an hour away. So, but as they lose the ability to care for the more complex patients in their communities, the hospitals often have to transfer these patients hours away. And upon discharge, many of these patients require, of course, post-acute care, and long-term acute care hospitals and rehabilitation hospitals. They've become less willing to accept these patients without the backup of their local hospitals. So I'm sure you hear this all the time. But then the staffing challenges have significantly affected the ability for these facilities to continue on. And we're seeing longer stays in these other hospitals because the locals cannot back them up. But hospitals get paid on a diagnosis-related group payment, as you're well aware of, DRG, which typically covers a normal stay with that reflects the diagnosis. So patients are staying longer, and they're exceeding those DRG payments, and hospitals are losing money hand over fist. But more patients are boarded, so to speak, in the ER waiting rooms on emergency room beds, and they're just walking out of the ERs because without being seen. But they're held longer in their smaller hospitals while waiting for bed placements in a larger hospital. We have all these issues that I'm sure you've heard from many others. But how do we overcome a financial challenge that was made worse by COVID and inflation? Inflation that we are seeing not only in Mississippi, but all across the nation. And have you or the agency considered establishing a temporary per diem payment targeted to hospitals to help address this?
Senator, everything you've said, I have heard, not just in states like yours, but when I was further up north in some of the northwestern states, they have large spans where there are very few physicians and healthcare providers. It's the same everywhere. Distance has caused a real issue. Telehealth was a saving grace during COVID, but that doesn't resolve it all. My wife, who's an OB/GYN, tells me about how in Sacramento, California, she will see patients who are coming from the very northern reaches of our state because the facilities there are not equipped to handle the needs of an OB patient. And so what you're speaking to is something that everyone is trying to figure out. How do we get resources and commitments into these communities? One of the things we're trying, and we look forward to working with you on this if you're interested, is we're trying to make sure that graduate medical education slots, the slots where you send a resident to practice, that maybe we can try to get some of these into communities that haven't always had these teaching slots available, because the evidence shows that if you locate a student who's in the residency program, by the time they finish that residency program in that community, they often stay there and develop their practice there. And so we'd like to see, for example, if we can encourage people to locate in communities because that's where they're getting their resident training and have them stay there as a result. Other thing we're doing, again, small, but still can be helpful, our Public Health Service Corps. There are programs that we have that have loan forgiveness or complete deferral, where if you commit to 5 years of service in a underserved area, as you just described, we will pay for your 4 years of medical school education. And we're trying to do what we can to direct some folks into some of these communities. On top of that, of course, you see some of the money that's devoted specifically for rural healthcare providers. Still small potatoes overall, but it's an effort to try to keep those facilities alive.
So are you saying the temporary per diem is not being considered?
I'd have to get back to you. I'm not sure if that is one of the considerations. I would suspect that one of those issues with a temporary per diem would be the cost. Where would the money come from to do that?
But you would let us know if
Absolutely.
that's in the plans, or if that's even something that anybody's working on
We'll
right
follow up
now,
with your
'cause
staff.
we hear from the hospitals, and they're thinking that may be a solution, and they ask me, and I said, well, I'll have the opportunity to ask him, so I would appreciate it if you
We'll
would get
follow up.
back. And my time is out.
I thank my colleague. We're going to go to Senator Daines. I'm just going to put one document into the record. Reference was made of how the notion, according to some, of making sure Medicare can bargain to hold down the cost of medicine would somehow reduce innovation and damage future drug creation. The Nonpartisan Congressional Budget Office looked at this issue specifically and estimated, their words, minimal impact of new medicines coming to market under Medicare drug price negotiation. This was an issue very important to me because clearly what we wanted was more competition without reducing innovation. That was the finding of the Nonpartisan Congressional Budget Office. Senator Daines.
Mr. Chairman, thank you. Mr. Secretary, thanks for being here today. There are several concerning proposals in this budget, including yet again the omission of the Hyde Amendment to allow for taxpayer-funded abortions. It's clear the administration has no intention of protecting the precious lives of the unborn. In fact, since the Dobbs decision was first leaked in May of last year, over 80 pregnancy resource centers and pro-life groups have been attacked and vandalized, as have hundreds of churches that support the pro-life cause, some even in my home state of Montana. Mr. Secretary, given the continued assaults against pregnancy centers and churches, would you publicly condemn this violence? If you want to do it right here, I'd be happy to hear it.
Senator, I don't believe anyone here would condone violence against any American, whatever the sort. And certainly I would hope that we could all work together to prevent any American from being harmed simply because they are either trying to exercise their rights or receive services they might need. So I would love to join you in sending a message to all Americans. Please respect people's rights and also make sure that we're not abridging people's rights.
You publicly condemn what's happened? Would you condemn this violence?
I would condemn any sort of violence against any American.
Thank you, Secretary, thank you. As you are aware, over 30 million seniors and people with disabilities in this country are enrolled in the Medicare Advantage plans, including 1/4 of Montana's seniors, due to the added choice and control it offers beneficiaries. Rural states like Montana face unique challenges when it comes to recruiting and retaining physicians. Oftentimes, we're a long ways away from larger communities. And the changes to the CMS HCC model in the proposed rate notice will further jeopardize Montanans' access to care. My question is this: what data can you provide that might show that the current rate notice will not impede access to care in rural and underserved areas?
Senator, thank you for the question because it is very important. The rate notice actually provides a greater level of funding than last year. And what we do is we try to make sure that it is funding that goes for a particular service and not to line the pocket of a middle person in the process. And what I will say to you, especially because of the rural communities that you represent, we need to make sure every dollar that the Medicare program puts out for Medicare recipients gets to service a Medicare recipient. And what we're finding is that too often programs are gaming the system. And for example, as you heard earlier, the programs, some of the plans are claiming that a Medicare beneficiary is sicker than what the person may be. As a result of upcoding that person, you get more reimbursement, even though you may not provide the care that a sick person under those circumstances would need. But what I will tell you is that at the end of the day, whatever we have done with this rate notice, it does not cut any benefit provided by Medicare, and in fact, it actually provides more resources to those who provide services under Medicare itself.
I want to shift gears and talk about Medicare taxes. Mr. Secretary, the President's proposed budget raises Medicare taxes because the President claims to care about the solvency of the Medicare program and that the wealthy should pay their fair share. However, there's mounting speculation and this is as reported in the Wall Street Journal, that according to his own tax returns, the president improperly classified the money he made on book deals and speaking events, allowing him to dodge over $500,000 in Medicare taxes. This is again according to the Wall Street Journal. How can the president propose tax increases on Americans and call for the wealthy to pay their fair share when he potentially owes $500,000 in taxes to the Medicare program?
Senator, let me respond on the Medicare program. The president's budget would make sure that not just for today's seniors, that they would get the benefits they expected when they paid into the Medicare program for decades, but it actually now makes it clear that moving forward to the next generation, that they would receive the same level of benefits. There would be no cuts, and that's the beauty of the president's proposal.
but
he figured out a way to do that.
The question is, don't you think this pledge to protect America's seniors might ring a bit hollow in light of the president's own hypocrisy of dodging $500,000 in Medicare taxes?
My suspicion, Senator, is that the president would challenge the way you've described his circumstance, but what you can't challenge is the fact that his proposal actually increases benefits under Medicare and it moves it forward and strengthening it for the next generation, something that no other president that I've seen when I was here in Congress for 24 years had really done. And I have not yet seen anyone in Congress really produce a plan like the president's that would provide that guarantee for seniors of tomorrow that they will have the protections they expect under Medicare.
Secretary Mattis.
And next, I recognize a new member of the Appropriations Committee, Senator Britt. Welcome.
Thank you so much, Madam Chairman. Ranking Member, congratulations to both of you. It is an honor to serve on your committee. Mr. Secretary, thank you for your time and being here. Many of the questions that I've had on various issues have already been answered, so I'm going to actually kind of take something that I saw Senator Capito talk about and dig a little bit deeper into it. The department's FY 2024 budget request includes $5.5 billion in baseline funding for the UAC program for unaccompanied migrant children, along with a request of $2.8 billion contingency fund to help address unaccompanied minors and other refugee issues throughout FY 2024. But as has been mentioned here today, the UAC program is plagued by deficiencies, poor management, which combined with this administration's reckless and irresponsible policies encourage illegal immigration and I believe have put the lives of children and their well-being at risk. We are spending a lot of money on a program that just isn't working very well. I believe it is not a lack of funding, it is departmental policy and management failures that are our problem. In light of the piece in the New York Times last month, as well as many other well-documented reports regarding issues with the UAC program, I want to ask you about some specifics here that I believe HHS could and should address. On March 31st, 2021, HHS's Office of Refugee Resettlement, ORR, issued field guidance that waived background check requirements for adult household members and alternative adult caregivers identified in a sponsor care plan submitted by Category 2 sponsors. As you know, Category 2 sponsors include certain relatives of a child other than a parent. So the department put in place a policy that allowed a waiver of background checks for other adults in the households of those relatives. That strikes me as deeply irresponsible. In light of recent events, can you tell me if the March 31st, 2021 field guidance is still in effect?
Senator, first, congratulations to you.
Thank you. I appreciate it.
And look forward to working with you in the future. On this particular question, I won't try to refute some of the things that you've said that I think are inaccurate about the program, because the men and women at HHS work very, very hard to protect these kids, thousands of kids that have passed through our hands as we care for them, and we do everything we can to not only care for them while they're in our custody, but find them a very secure placement.
Yeah, yes, sir, and I don't believe that it is actually the people at HHS. I said it is the management and the policies, and so the policy of not checking the background of these individuals in a home that we are putting a child in, my question is that still the case?
Right, and I think you've not stated it properly, because we do background checks.
Good.
So the sponsor of any child has to go through background checks.
Okay, and not the sponsor, but anyone in their household.
And so if the sponsor is one of the immediate relatives, or for example, if it's the parent,
right.
Then we, in order to get the child to the parent, because again, what we are always told, whether it's through the courts or whether it's through the best advice of professionals who know about the best interests of a child, they say it's better to have a child with someone who loves them than have them in a federally sponsored congregate care setting. And so we place them with the child's parent if we can. And if it is a child's parent, for example,
right.
we will not do the full background checks of those who are in the household, assuming that the parent is going to be responsible for the child and make sure that anyone in the household will also take care of the
So
parent.
if it's not a parent, though, just so you and I are on the same page so that we're speaking the same language here. If it is not a parent that you are placing them with, do you do a background check of the other individuals in that home?
It will depend on who that individual that we're looking at as the sponsor would be, because the further removed you get from the parent, the more we have to have a sense of security that the person who is going to be responsible as the sponsor can indeed take care of that child. And so it would really be based on that.
Okay, I just want to let the record reflect. Obviously, if it's a parent knows what's best for a child, and that's what we have to know. But if it is not a parent, we need to be checking into everyone in that household. What we've seen happen to these children is completely and totally unacceptable. There are so many who have been forced into sex trafficking, have been forced into labor trafficking, of which we know we've got to make sure that we're taking a look and that we're trying to keep them safe. And so the field guidance then, I guess, is not in effect then, the March 31st, 2021 field guidance.
I'll get back to you on the field guidance, but I'm not aware of any sex trafficking of the kids that we have sent out, we've been able to place with the sponsor. If you can provide us with the evidence that there's been sex trafficking, we'd love to see that.
Absolutely. And so the decisions to terminate any of those things, I'd love to follow up with, and I'll submit some questions for the record for that as well. And so when you're looking at the different things that are occurring also too, I only got 14 seconds left, guys. I got to learn how to do this quicker.
Negative 14.
No, negative 14. Okay. Guys, thank you for your time. I have a number of other questions within that
We
line
can follow up.
that I would love to get to the bottom of. These children, it's a passion for me as a mama of 2 school-age children that we are making sure that we're not putting them in harm's way.
I thank you for your passion.
Thank you.
The gentleman yields back. The chair now recognizes Mr. Latta for 5 minutes for questions.
Well, thank you, Mr. Chairman, and thanks for calling today's hearing. And Mr. Secretary, thanks for being with us. I'd like to go back to what the chairman had started in his opening statement, some questions on fentanyl. My seatmate and friend from Virginia, we have the Halt Fentanyl Act that would make sure that for once and for all that fentanyl is going to be a Schedule I drug. And I just want to make sure that you're on board that fentanyl should be a Schedule I.
Congressman, as I've said to the chairman and others, FDA agrees that we need to continue the scheduling of fentanyl. I leave it to FDA to make those decisions on how it should be scheduled. And FDA would also say we need a comprehensive approach when we deal with either fentanyl or other drugs that are killing Americans.
Well, that's important because, again, when we've had roundtables and hearings in here, I think it's important to point out that one of the terms I try not to use anymore is the word overdoses. It's poisoning, especially when we're talking about fentanyl. And when you look at the over 71,000 people that died last year in this country because of fentanyl, it's poisoning. We had one sheriff actually say that when these drug cartels know what they're putting in these pills and sending them north, it's not poisoning anymore, it's murder. And so I'd like to just go to a sentence that you have and just ask a couple of questions on it. You said NIH will continue to invest over $1.8 billion in research on opioid misuse, addiction, and pain disorders, including the Helping to End Addiction Long-Term HEAL initiative. Now, the question I have is because, again, I'm not sure exactly when this has been put into place and how long it's been going, but as we've seen the trend of fentanyl poisoning and also all drug overdoses and other sorts going up in this country to about 107,000 in 2022, that the question then is this effective? Because again, in this committee, because we do have broad jurisdiction, when we talk about things that's online and drugs that are coming into this country, when we're being told by law enforcement and the DA and everyone else that when drugs are coming across this border, that the cartels are making a fentanyl-laced pill for a dime that are killing Americans. And they're making $30 to $40 off each of these pills. And so, as was pointed out earlier, that when you have 18 to 45-year-olds is the leading cause of death now, is when you're looking at either fentanyl poisoning or some other type of a drug overdose. Are the initiatives of this $1.8 billion being effective right now?
Congressman, thank you for the question. I think $1.8 billion is a major investment. If in the wisdom of this body you wish to give us more resources, I guarantee you we'll make good use of them. But I understand that there's a conversation about cutting, not increasing, on your side of the aisle. So I hope that what you're
let me ask though, because again, what we had testimony from parents that have lost loved ones, and the question and the problem is, again, as I said, these pills are flowing across the border. And then they're getting in through the internet, and pretty soon we can't even track where they came from. But when somebody buys one of these pills, a younger person, they're thinking they're getting X, Y, Z, and it turns out a fentanyl-laced pill. What's the department doing to warn Americans? Because again, with that $1.8 billion, you do a lot of information out there. Is what's going on, warning people, kids especially, don't buy anything on the internet. And the reason I bring this up, it's been a few years ago, but I sponsored the track and trace legislation. And what that legislation did was to make sure from the time that a drug was manufactured, the time it was delivered, we would know every stop that it wasn't counterfeited or adulterated along the way. So, that's hopefully for a prescription drug or something else that's flowing naturally and legally through, that's people know what they're going to get. But how are we warning people online that are online today buying these pills that it's not a counterfeit or a knockoff? This drug could have, or this pill could have fentanyl in it that will kill you. And this is the problem. When we're seeing the numbers going up, and so that's my question on this is that, we understand research and misuse and addiction and pain disorders, but how are we getting the word out that people don't do this?
Congressman, much of that work is actually done not by NIH, but by SAMHSA, our substance use and mental health agency, which deals with that. And they are working with states and local entities that are actually doing the work on the ground to support some of those efforts, to inform and to do the surveillance. They're also taking on best practices, using evidence-based practices. For example, fentanyl strips are now being made available. We are finally supporting that at a national level because we know it saves lives. You heard the news today that Narcan is now going to be available over the counter. The FDA has made that announcement. So we're doing the things that we can at the federal level to support the work that's done on the ground at the local level.
My time has expired. Are you back?
And the gentleman yields back. The chair now recognizes Mr. Cardenas for 5.
Mr. Secretary, when you were the Attorney General in California, your state expanded its ban on 18 to 20-year-olds owning handguns, including rifles and shotguns as well. And I'm just curious, why do you think that 18 to 20-year-olds can't be trusted with a firearm?
Congressman, let me try to take you back a little bit when I was Attorney General in California, but first by saying, for us here at HHS, gun violence is a healthcare crisis in this country, and we have to do everything we can. I'm proud that my state has tried to undertake measures that would try to keep individuals from using, especially assault weapons, for purposes that never should be deployed in a civilian society. And so,
but you supported these policy changes. I'm just curious, what was it about 18 to 20-year-olds that you focused on to take away their gun rights to own rifles or hunting shotguns and other firearms? What was it about that age, 18 to 20-year-old?
Yeah, we could go back to the legislative record. I was not the legislator, a legislator who voted for that legislation, but I was the AG who defended our state's laws.
But you didn't believe that an 18-year-old should be allowed to own a hunting rifle. Is that? I mean, that's what you supported then. You still believe that today?
My job as the Attorney General was to defend the laws that the state of California has enacted.
So you do think that an 18-year-old should be allowed to own a hunting rifle?
Congressman, when you are the Attorney General, you have an obligation to support and defend the laws of your state. I happen to believe in many of those laws that help us not only protect Americans from gun violence, but also keep weapons of destruction out of the hands of Americans when it's not necessary.
Okay, interesting way to dodge the question. I mean, back then you clearly defended and supported changes in the law to stop 18 to 20-year-olds from being able to own a firearm. And I just want to ask this question. Why do you think that children much, much younger than 18 years old, 9, 10, 11-year-olds are mature enough to make a decision to have a sex reassignment surgery?
And
because you support those policies too. So can you defend that for the committee? Why do you believe that a 9, 10, or 11-year-old should be allowed to change their sex?
So let me be clear. My position, my views have not changed with regard to gun violence and what we should do to try to control that mass killing that's occurring. And so whatever my views were when I was Attorney General on those issues are still probably the views that I have now. Again, I'm not the Attorney General of California anymore. With regard to the health care of any individual...
Let me just be really clear. Then you believe that an 18-year-old shouldn't be allowed to own a hunting rifle. Today you believe that a 9, 10, or 11-year-old should be able to change their sex and have an irreversible surgery to do that. Just help us explain the logic.
Yeah, Congressman, I would appreciate you if you let me characterize what I believe, and we can have a good conversation rather than you characterize what I believe. And what I would say to you is, with regard to gun violence, I think it is important that we take actions to protect our communities and our neighborhoods. With regard to
I don't think you want to explain it because you realize how crazy it is, and that's why you're dodging the question. Let me move on. This spring, HHS released a 112-page report claiming that gender affirmation, including social transition, changing one's name, pronoun, and/or appearance, is appropriate and beneficial for gender minority children and adolescents, according to this report. The report recommends cutting federal funds from states with, quote, policies that stigmatize transgender children, including by denying them access to medically necessary health care, end quote. Mr. Secretary, does this mean that HHS is seriously threatening to withhold hospital grants from states like my own if they refuse to go along with surgeries or puberty blockers for kids?
Congressman, we're going to protect the rights of any American to get the health care they're entitled to. And if someone tries to stop them from that, that's a violation of the law.
So you would withhold hospital grants from states like mine that ban transgender sex reassignment surgeries for minors? I mean, that's what the report says, clearly.
We will protect the rights of any individual to receive the health care they're entitled to, and we will take action against anyone who tries to discriminate against a person.
That's a yes. And I want to ask you the same question that I asked Secretary Cardona the other week. Do you support pulling federal funds, federal school lunch benefits from schools that refuse to comply with your definition of gender identity? Withholding school lunches from kids in schools that won't recognize the definitions that you do.
Congressman, I would not hold anyone to the standard of having to uphold my definitions. I would hold them to a standard that protects what the rights of Americans are under the law.
It's pretty clear what you believe. The report says so. Madam Chair, I hope and pray one day that the history books look back and realize just how crazy the policies of this administration are. And Mr. Secretary, your photo with the president is going to be in those history books as history will not look back fondly on your policies. I yield back.
Thank you. Mr. Chicano.
Thank you, Madam Chair, and thank you for being here. I know there's been a lot of talk today about the unaccompanied minors and the children and whatnot, so I want to try and clarify it and just get some simple answers. You vet the sponsors who you place the unaccompanied minors with, right?
That's correct.
Okay. How many total unaccompanied minor children do you think you deal with every year? Every year.
I believe, and I can try to get you the accurate numbers, but I believe in 2021 it was something over 120,000 children.
So, okay,
yeah.
Roughly 120-ish,
yeah.
Give or take. Okay.
2022 close to that as well.
And I've heard, I know the New York Times obtained data from your office and your department saying that your agency had failed to reach more than 85,000 unaccompanied minors. Is that inaccurate?
Completely inaccurate.
Okay. Do you know who they contacted from your office? So this is just a bogus story that the Times put out?
No, it's that they use statistics in the wrong way. Because we try to track children, and we, as I mentioned in a previous exchange, we reach out to these children. to the children and to the sponsor.
And if they don't respond, they get checked as they haven't responded. Okay.
We make note all the
So
time.
how many unaccompanied minor children are actually unaccounted for?
Are what?
Are unaccounted for? So if let me give you an answer. So, example. We vet and place 120.
Correct.
1,000, give or take, ish, right? Of those, how many are not accounted for? How many of those people don't respond?
So when you say accounted for, are you saying how many do we try to check on their status?
I'm going to say you try and check all of them.
Correct.
Right? Okay.
Correct.
How many of those people don't respond and we aren't able to track?
The vast majority, I think it's over 80%, we have been able to reach either the child or the sponsor, and we make an effort 3 times for each child.
Okay, so roughly 20%
did not
we
respond.
are unaccounted for.
Not unaccounted for because they are with their sponsor likely.
Well, how do you know they're with their sponsor if you haven't been able to contact the child or you haven't been able to contact the sponsor?
Because when we place them, they are with the sponsor. Now,
Okay, but I place you today, but you may not, if you don't respond, right, the sponsor doesn't respond, or the child doesn't respond, how do you still know that they're with the sponsor?
Well, HHS doesn't have the jurisdiction to try to follow those children. And so when you say they're unaccounted for, you're implying that we should be able to account for them. Once they are placed.
But you are.
I'm sorry?
But you are. So my point is, let's just say you place 120.
Correct.
Right? There's a whole batch of unaccounted children that we don't know. We don't know if they're being trafficked, right? Because we know human trafficking is a problem. We don't know if they're in child labor, right? In my state of Michigan, we had this issue with child labor. We don't know what's happening to these children. We're making some pretty broad assumptions. That's all I'm saying. Are you disputing that fact?
No.
Okay.
No.
All right.
But could I clarify?
Sure.
This is not like a foster care program where
No,
the
it's
agency.
worse. I would agree.
In many respects, you're right, because
it's
there is
worse.
no connection. And
Right. Right.
saying they're unaccounted implies that there is a way to account for them, and Congress never
Well, there
gave
is a
us the-
way. There
How?
is a way,
How?
because you just told me that you are accountable
No,
for, well.
but I can't account for them because I don't have jurisdiction. I don't have jurisdiction
Then
to
why
their
are
part.
you tracking them anyways? If you have if you
Because we
don't
think-
have any jurisdiction, you shouldn't be following them anyways. Is that what you're telling me?
Congresswoman, because we believe
Is that
it's
what you're telling
important.
me?
We believe it's
So you
important.
do have jurisdiction.
No,
Then why are you doing it?
because we believe it's in the best interest of the child.
And I believe it's in the best interest of the child. So would you agree with me that there's 20% of the children that are just twisting in the wind that we're
No.
making a bunch of assumptions on?
Absolutely not.
But because I think it's very convenient that you say, oh, but we care so much about the kids, the ones we account for, the ones that we
No.
can't account
We
for.
reach-
Yeah,
we
that's
reach-
really not my, that's not my
Congresswoman,
jurisdiction.
remember, we
So
try to reach
let's just
every
use the
child.
same context and go. So are you accountable or not accountable?
Do you if
I'm
you give us
asking
the
you the
authority,
questions.
we don't
Are you
have the
accountable
authority.
or not accountable?
We do
Yes or
not
no?
have the authority from Congress to try to keep account of these children once
So
they
that's
are
not
placed.
your job is to have.
That's not what we're
Your
saying.
job is to vet them.
That's not what we're saying.
And then let them go.
That's why we try to reach out to
I don't think you know
these
what you're
kids.
saying because you use the laws that's convenient for you. If we really truly care about the children, we'd care about it when it's convenient and when it's not convenient. And we'd begin to fix a problem that we know we have as opposed to try and cover our butts. With
And
that,
Congress
I
give
yield
us
back.
the
Thank you.
jurisdiction to try to account for these kids.
Thank you. Thank you, Mr. Secretary. Thank you, Ms. McClain. Concerns about HHS policies about children who identify as a gender that's not their biological gender. Specifically, I expressed my concerns about parental rights not being respected in basic decision-making about life-changing treatments and surgeries. You fail to respond timely or completely. I again wrote to you on January 12, 2023 to request you provide timely and complete responses. You responded, but Mr. Secretary, you neither fully nor completely responded to my questions, and particularly my document request. Will you commit to providing timely and complete responses to my questions and documented requests in my letters of December 22, 2022 and January 12, 2023? Yes or no?
Madam Chair, we will work in good faith with you to try to address any requests that you make in your oversight capacity.
Will you commit to providing timely and complete responses to all letters I send you henceforth?
Congressman, we will, again, work with you closely and certainly in good faith to try to address any requests. As you know, the longstanding practice in the executive branch is to try to respond to the requests of the chairs of the committee so we can make sure you have that information.
You're going to need to work just a tad harder to comply. Mr. Secretary, in my earlier letters to you, I noted how the family is the most basic unit of society, and parents have the inalienable right and responsibility to educate and rear their children. Yet there are examples around the country where Child Protective Services have taken children from the homes of loving parents because parents do not support life-altering surgeries or other medical interventions on their children who have been diagnosed with gender dysphoria. In California, one parent lost custody of her daughter, and court permitted only 1 hour of visitation each week because the mother did not want her daughter to receive gender interventions. In Ohio, a husband and wife lost custody of their 17-year-old daughter because they would not consent to cross-sex hormones. Instead of standing up for parents, the Biden administration has pushed to make it easier for children with healthy bodies to access puberty blockers, cross-sex hormones, and life-altering irreversible surgeries. I'm saying children. HHS has even weaponized its Office for Civil Rights to threaten providers and health plans that refuse to assess children diagnosed with gender dysphoria in receiving surgical or hormonal medical interventions. What planned regulations and guidance documents do you have under consideration for the Child Abuse Prevention and Treatment Act, Family Violence Prevention and Services Act, and child care programs that will discuss policies related to gender diverse, gender minority, or transgender issues?
Congresswoman, that was either a very long question or I missed the actual question in the comments.
What regulations and guidance do you have planned under the legislation, Child Abuse Prevention and Treatment Act, Family Violence Prevention and Services Act, and child care programs?
We will do everything through regulation that we can to make sure we can enforce the statutory provisions in those acts to make sure that we're protecting every individual that's entitled to those protections under those new laws. We'll do everything for a transgender child that we would do for any child because they have the same rights to access care that they need.
You mean you're going to protect children who have one biological sex and may think that they have a different biological sex? So what's your estimated timing for such regulations and guidance?
Congresswoman, I can get back to you on that because I can't say that there's a particular time frame, but I would say that gender-affirming care is a standard of care that's recognized by every major medical association in this country, and that means that you're talking over 1 million providers who have been part of that process of affirming that type of care. And so what we're going to do is make sure that when it comes to implementing the laws that you and your colleagues have passed, that we do it without discriminating against any group and we protect every individual.
It's unfortunate that you don't have the same feeling about protecting the lives of unborn children so that they would have the chance to be born and live life. Mr. James, you're recognized for 5 minutes.
Thank you, Madam Chairwoman. Good morning, Mr. Secretary.
How are you?
Or I guess it's after.
First thing I'd like to submit for the record, Administration for Children and Families, OR Field Guidance Number 10 and Field Guidance Number 11.
Without objection.
Thank you. Last week I met with a young gal, 15 years old, who unfortunately let herself get tied up with what is quickly becoming the medical establishment. She had been on, I think, testosterone and puberty blockers, wound up getting her breasts cut off at age 15. Now she just feels horrible about that. To a degree, she feels she's made fundamental changes in her life, and she's never going to be able to live a normal life. I've also read a book, When Harry Became Sally, by a guy by the name of Ryan Anderson, which talks about the horrific long-term effects of these type of gender, what I guess you guys would refer to as gender-affirming healthcare. Mr. Secretary, what are puberty blockers?
I'm sorry, Congressman.
What are puberty blockers?
Congressman, there are a number of medical treatments and services that are provided to Americans to fulfill their health care needs.
Yeah, what effect do they have on brain development? Do we know that?
Well, based on the recommendations of a physician, an individual would be recommended for
Yeah, I
certain
know.
types of medicine.
Do we know, have we done like studies over a period of 20 or 30 years? So we know the long-term effects of puberty blockers on kids. Seems to me a very significant thing that I would never allow anybody who was asking for my advice ever to take. What is the long-term effect over 20 or 30 years?
Well, there is scientific and medical evidence with regard to the practice of some of these medicines. These are treatments and
Where's that
therapies.
evidence?
There are a number of medical journals that we could cite you to. There are a number of physicians who've been providing gender-affirming care for quite some time. Most every major national medical association supports gender-affirming care, and so it's not new. It's been around.
Isn't it true that on some of this stuff, Scandinavian countries, Dutch countries, at one time recommended this and they don't recommend it anymore?
I'm sorry, who did not?
Scandinavian countries and the Dutch.
Congressman, I could tell you about America. I'd be out of my lane if I tried to
Doesn't
tell
bother
you
you
about
that European countries at one time used these and now are backing off?
I think we have some of the best medical professionals in the world. We do some of the best research. I trust the medical judgment of those who are experts in this field.
Okay, I guess I'd ask you to familiarize yourself with what's going on in other countries and see why they're backing off this sort of treatment. Next, are you familiar with studies that show, increased levels of suicide, depression going with people who take these puberty blockers, and much less people who have surgeries when they're 15 years old?
Congressman, we can talk about a lot of the research and the data. I will tell you that what we know at HHS is that many of the transgender youth that are having very difficult, traumatic times find that getting gender-affirming care has been helpful in
And that means
their lives.
you stand behind the idea of a 15-year-old girl having her organs removed. You think that is, under any circumstance, appropriate? 15?
Congressman, you're asking questions that are issues that are made or judgments that are made by that individual patient with that patient's physician, a medical expert,
She's
not a politician.
15. I know she's making the decision. She was 15. Doesn't that mean anything to you? You think this is appropriate for a 15-year-old?
It means a lot to me that a medical professional is the one guiding that patient's decisions, not a politician, not a bureaucrat.
Okay. Want to switch really quickly to ORR and the type of people who are becoming sponsors. Frequently these people are becoming sponsors, claim to be relatives of some nature. Do you ever do DNA tests on these people to assure that they're related if they claim they're related?
We do a number of background checks. We include fingerprinting.
Do you do DNA tests?
We do background checks, and we do them
That's
the way
that
they
means
have.
no?
That doesn't. I can tell you what we do.
Yeah, that's what I want to do. You do DNA tests?
We do background checks that include fingerprinting. We
It's
check.
just a yes or no question. Okay, I know that at the southern border, the Border Patrol does DNA tests sometimes if somebody says. I gave you a yes or no question. You have the capability of doing DNA tests. Do you do them or not?
Mr. Grothman, I think the witness answered your question.
No, he didn't answer the
Well, he did.
question.
He didn't answer it, so he answered it. Ms. Wilson, you're recognized for...
Secretary.
How are you?
Or I guess it's afternoon now. Good afternoon,
is it
Mr. Secretary.
afternoon?
Secretary Becerra. The State of the Union this year, the President of the United States of America stood on the House floor and lied to the American people. He stood on the floor and said the Republicans wanted to take away your Social Security and Medicare. In reaction to these lies, I proposed H.R. 875 to divorce the debt negotiation proceedings from health care so that our seniors were not used as pawns in that negotiation. But as a result of these lies, I get comments back from my constituents. One from Rochester Hills who writes, Rep. James, I'm concerned about the debt negotiations that were underway in Congress, and they could jeopardize current and future Social Security and Medicare benefits, which I rely on. Another of my constituents from Sterling Heights wrote in saying, it's outrageous that some are suggesting cutting Social Security and Medicare in the debt debate. I've heard a lot about misinformation in this hearing today, but the greatest purveyor of misinformation in the past few months has been the Biden administration. There's been a lot of fear-mongering, and to establish the trend, the White House also lied about cuts to VA benefits. I'm a combat veteran. I have felt the sting of not only the physical wounds of war, but the unseen wounds of war. And the increase above the president's budget of over $18 billion that went to that VA has invalidated that misinformation from this administration. Mr. Secretary, what also concerns me, in addition to this misinformation from the Biden administration, is that it seems to be more concerned with expanding government-run programs when free market options exist to bring down the cost of health care. Many of my constituents are asking me, why must the government continue to spend more and more and more to force them, to make them beneficial, rather than supporting free market alternatives that could at least alleviate a little bit of pressure on the taxpayers to foot the bill, while also increasing quality and choice. Right now, my understanding is Medicare Part A is expected to go insolvent in 2031. Is that also your understanding?
Medicare Part A will face a challenge unless Congress, you all act to provide it with more resources, yes.
Do you believe that Congress should act to maintain the long-term stability, security, and sustainability of Medicare?
Yes, of course. And the president provides a proposal to do so.
Would you agree that increasing expenditures has put us in this mess in the first place? Hey, I'll even credit you. Both administrations, Democrat and Republican, spending without controls, without checks, and without commiserate attention to the nutritious and environments that we're putting our people in. Do you believe that spending in Democrats and Republicans have put us in a situation where Social Security and Medicare could go insolvent within our lifetimes?
Well, Congressman, as you know, Social Security and Medicare don't rely on what the budget that you pass on a yearly basis does, because Social Security and Medicare operate on their own terms.
Okay, so irresponsible fiscal policies. Do you believe that irresponsible fiscal policies have put us in the position where our seniors now and in the future are at risk? And do you believe that Congress and the administration have a responsibility to fix that?
Fiscal policies must be enacted that keep the interests of our families in mind, but Social Security and Medicare operate on their own terms.
Do you believe that Congress and the administration have a short and long-term responsibility to get Social Security and Medicare back on the right track? Yes or no,
I
please?
would hope that you would act to make sure that we keep Social Security and Medicare working well for everyone.
Unless it's a yes. I don't want to put words in your mouth. Okay, I'm going to assume that's a no. Madam Chair, before I conclude, I don't want seniors to lose their benefits, and I'm going to do everything I can to protect seniors' benefits. With that, I yield.
The gentlelady from Florida, Ms. Kamek, for 5 minutes of questioning.
Thank you, Secretary Becerra. I want to start with your attention here on this jar. Do you see this? Do you know what this is?
Looks like candies or snacks.
Unfortunately, the reality is much more grim. These are wristbands that the cartels force people to wear when they cross the border. And if you're not wearing one and you cross the border, the cartels will take a limb or an appendage. This is what these people are forced to wear, and it dictates what cartel they belong to, how much they have paid. And they are absolutely a part of the horrors of trafficking and smuggling that occurs at our southwest border. And I have to point this out because I want to tell the journey, because this has really been laid out in bits and pieces along the way by my colleagues, and we're here to talk about these kids. So if you could turn your attention to the screen real fast, I want to show a quick photo that I took. It was 11:46 at night. I myself took this photo. That little girl that you see was acting terrified, not of the agents, not of myself, but of the man holding her. The very next day at the Donna Processing Facility, we threatened, and I was there to witness this man with a DNA test. He confessed that he actually was not her father, that he had rented her. This is a process called recycling. Now, I know we're here to talk about what happens to these kids after this point, but this little girl was then turned over to HHS custody, your custody, and you've talked at length today about the vetting process, right? And so you now know that this little girl, not through a DNA test, she's not related to that man. She now is in your custody. You have your own case managers who are supposed to vet these processes. And we, of course, know this from the Florida grand jury. These case managers have very little training or no training in interviewing these individuals, particularly children and young children who have been traumatized. You can imagine this man who you just saw on the screen, who, by the way, was a convicted sex offender with this child. You can imagine the trauma that that child had sustained. Your own case managers are not trained in examining, evaluating, or recognizing documents as authentic or fake. She came with no documents. They have no official training when it comes to trauma-informed interviewing skills, no official training when it comes to investigating the safety or legitimacy of addresses to which a UAC may be sent. Now, I don't know what happened to that little girl, but what I do know is that the sponsors that you claim to thoroughly vet, which I would love to get your definition of thorough, because you haven't been able to articulate that here today. It also would include the fact that these kids show up with numbers pinned to their clothes or Sharpied on their bodies to call. Agents have reported in official testimony that these kids have the numbers, the same phone number Sharpied on their arms time and time again. Now, we've heard, of course, of situations where the same sponsor is being called, and magically 20, 30, 40 kids end up with that sponsor. And again, I go back to your statement of we thoroughly vet. You've really emphasized that. Do you vet every member of the household? And does it include an FBI check? Does it include an Interpol check? I would hope that it would, considering that we've had 151 different nationalities cross the southwest border under the Biden administration. But I'm guessing that it doesn't, because only 9% of the UACs are subjected to a DNA test with their sponsor, less than 23% to a background check. And again, I should point out for the record the fact that you release these folks, these kids, to sponsors that are in the country illegally. By definition, they have already broken the law. Is it a standard operating policy to release children into the hands of sponsors in households that haven't been properly vetted and that are here in the country illegally?
I think I heard a question there, and so I'll try to respond because you packed a lot in there, a lot which I think has a lot of misinformation and that I disagree with. I could first start by saying that we do go through a thorough process on assessment of the child when the child first comes to our attention. So that
What
little
is your
girl,
I'm sorry, I'm going to reclaim my time. Secretary, what is your definition of thorough?
I mentioned it in a previous
Does it include
response.
a DNA test?
An assessment of the child's
No, that is not my
situation.
question. My question is, does it include a DNA test, yes or no?
DNA is one of the tools that we use on occasion.
In only 9% of the cases. Does it
It is
include a
tool that
background
we
check?
use. We do a number of things to go through a series of tests and assessments of a child when we get them. We do
And a
the same
background
type
check
of
in
vetting.
only 23% of the cases? And the DNA, by the way, that you rely on in your ORR case managers, if you could please pull up Exhibit 2. This shows that the DNA requirements that you rely on in the case files, I realize this is a CBP document, but this memo is something that is really important for what we're talking about, because so much of the case files that your case managers rely on in vetting these thorough checks, they've suspended the DNA requirement. I'm out of time. I know you want to answer the question anyway and deviate from your carefully crafted talking points, but I think this is disgusting that 85,000 children are missing, and it's on your watch. With that, I yield
Gentlelady
back.
yields back. Now recognize the gentleman from California, Mr. Cardenas, for his 5 minutes of question.
Thank you, Mr. Chairman. Appreciate this opportunity to have this discussion and this public discussion on this very, very important issue. Mr. Secretary, you've inherited a deeply challenging task, and on the heels of the Trump administration's egregious and inhumane family separation policy, you're charged with protecting kids who are increasingly exploited and forced into child labor by U.S. corporations, being forced to work with unsafe machinery and hazardous materials, risking literally life and limb. All of this because of lackluster approach to protecting children by some of my Republican colleagues and the twice impeached president who routinely vilified and mistreated immigrants. Let me be clear, child labor is child abuse, and this needs a strong legislative response at every level. Unfortunately, current child labor protections do not go nearly far enough to deter child exploitations. Corporations, U.S. corporations, find ways to shield themselves from liability by employing third-party contractors, for example. This deserves all of our attention. We need solutions designed to protect children. Meanwhile, child labor laws are being systematically weakened by many Republican legislators at the state level. For example, in at least 10 states, legislation has been proposed to roll back modest child labor protections in an attempt to enable multi-billion-dollar corporations to exploit children right here in America. Immigrant children are getting tangled in barbed wire and drowning in the Rio Grande, Texas. I hope that we hear outrage of that from every single person in Congress. If Republicans are concerned about these kids, they would do everything in their power to make it safer for them to seek asylum. They would make it harder to exploit them and abuse them right here in our own country. Also, one of the solutions that seems to be on the minds of some of my Republican colleagues is claiming that the solution is to the exploitation of unaccompanied minors is to shut down immigration at the southern border. This approach is unconscionable and it's just un-American, and it's also untenable. Unaccompanied children are some of the most vulnerable among us, and the United States has a moral and legal obligation to ensure that those children are safe. I refuse to have us turn our backs on children fleeing war, violence, persecution, and abuse. We can address exploitation by making sure sponsor vetting reflects best practices and equip ORR to provide post-release services. And by having a 60% cut, which is what some of my colleagues want to do, is not a solution at all. But we should not tolerate the simplistic and inhumane proposal that the answer here is to shut down the southern border. It's time for us to get serious about how we can support these children and not inflict unnecessary cruelty on vulnerable children. I have a question for you, Secretary Becerra. How have state laws rolling back child labor protections impeded HHS's ability to serve and protect unaccompanied children after being released from OR custody?
Congressman, thank you for the question. And as you know, in order to be able to enforce laws that protect our children from exploitive labor, we need to have a partnership with our state partners, because it won't be enough to just try to do it through the Department of Labor at the federal level or with HHS. We need to work with our state partners. And if a state is actually diminishing its protections against child labor, it sure makes it tough for us to go out there and enforce against this type of exploitive practice.
I think by diminishing those local laws, it actually encourages bad actors across this country to just even do more. Have there been other efforts at the state level to restrict corporations with ORR? If so, what presented the greatest challenges?
Well, our challenges is trying to make sure we can spot where the exploitive activity will occur, and so we can make sure that any sponsor who wishes to take a child would not engage in that activity in cahoots with those employers. And so the more sight we have on that working with the Department of Labor, the more likely we'll be able to prevent the child exploitation that occurs.
So Department of Labor at the federal level, but there are also departments of labor at the local level in states, right?
In fact, they're more important because they are on the ground and have greater resources and personnel to try to protect labor laws, especially for children. The department at the federal level, Department of Labor, is very stretched, and we continue to do these partnerships so we can get the best efficiency out of our working together to protect these kids.
Well, I hope Congress gives you more resources to do the job that is needed to be done. My time having expired, I yield back. Thank you.
Gentleman, yield.
Thank you, Madam Chair and Ranking Member. Appreciate you holding the hearing. I want to thank you both for being here. Look, my top priority is defending Montana and keeping our nation safe. It's just that plain and simple. That means getting the situation at the southern border under control. I have said this directly to you many times before, Secretary Mayorkas, and I reiterated to the President Biden last week. This administration needs to do more to secure our border. You guys have to do a better job prioritizing additional funding and the resources that Congress gives you to stop the deadly flow of fentanyl, which you talked about in your opening statement. Fentanyl that is taking the lives of Montanans and folks all across this country. When I talk to Border Patrol agents or men and women in law enforcement, they tell me the same thing. They need more manpower. They need more technology. We have to know who's coming into a country and what they're bringing, and that starts with the folks on the ground and giving them the tools they need to get the job done. I do agree with some of my Republican colleagues here today in that in addition to additional border secure funding, Congress must also step up and pass bipartisan policy reforms to fix this broken immigration system. Congress needs to stop playing politics with the border. Congress needs to roll up their sleeves, and we need to do our part to implement meaningful solutions to address the chaos at our border, address workforce issues, and keep our country safe. So, Secretary Mayorkas, I have taken a look at your supplemental funding request. I see money to hire agents, to detain and remove folks, to install more technology, to combat fentanyl. But what in your proposal is actually going to plug the holes in our border to stop those intent on illegally entering the United States?
Senator, I think it is precisely what you have identified and what our supplemental contains. When we talk about hiring, for example, additional personnel to conduct the case processing, that means we can get more Border Patrol agents out into the field, which is where they belong to do the jobs they swore to do and they signed up to do, which is apprehend individuals who are seeking to evade law enforcement. Hiring additional Border Patrol agents accomplishes that as well. The technology that we seek to deploy, it is force multiplying. And so all of the things that we include in our supplemental achieve precisely the outcome about which you inquire.
So I will tell you what I was told about the supplemental. I thought it was very helpful, but didn't see a lot that would directly impact the areas in between the station. Your testimony last month, I believe in front of the HISCAT committee, said that in FY23 there was about 600,000 people that entered this country illegally. That's a lot of people. That's a lot of people. Do you feel confident in this supplemental that you can shut that down? Those 600,000 that were coming in, do you have faith that you'll be able to significantly reduce that number?
I do.
And do you have any goals in mind there? And you anticipate you'll be able to do it with manpower and technology, I assume?
Manpower and technology, yes, will significantly advance our efforts. Senator, as you well know, you and I have spoken over the years, the phenomenon of gotaways has been a challenge ever since our department was created. In fact, in the first decade of our creation, the number of gotaways was far in excess of what we are experiencing now. But personnel and technology are the two key elements to that effort.
I would just tell you that it is really, really important, and I think in a bipartisan way, really, really important, especially considering what all has gone on in this world, that we know exactly who's coming across that line. And if this supplemental does that, we will hold you accountable to that.
Senator, let me be clear. The supplemental will assist us in advancing our mission dramatically. It is the funding that we require in addition to our annual funding. We also need the system fixed. It is not just funding that will cure all of the challenges. We need our immigration system fixed. The president submitted a proposal on day one of this administration. We have to work on that and build on that. That, too, is a critical element to meet our challenge.
I couldn't agree with you more. We need it fixed. And I think we need to come together. We need to fund Israel funding. We need to fund Ukraine funding. We need to stop playing politics, and we need to get it fixed. We need to help you do your job, and then we need to hold you accountable to do that job. Thank you, Madam Chair.
Thank you. Senator Hoeven.
Thank you.
Secretary Becerra, you're asking for an additional $1.9 billion for the Office of Refugee Resettlement, yet your fiscal year 2024 budget request was for an increase of only about $830 million. Now, it's been clear since long before the budget was released that the number of unaccompanied children, refugees, and other entrants was growing, and that ORR would need additional funding. Given those facts, why didn't you request more funding through the normal budget process?
Senator, thank you for the question. As you know, and as Secretary Mayorkas can attest, it is never a known commodity or quantity, the number of people that will show up, the number of refugees that will need help. We are still, for example, receiving Ukrainian refugees. We thought 100,000 refugees might come to our shores. We're now over 180,000, and we think that our estimates are, projections are, that we may have another 80,000 Ukrainians who may be coming in. What we have to do is continue our obligation that this country has always had to those who seek protection from persecution when they come to our shores. Without that support, and this money is focused on refugees, without that support, the services we provide in partnership with local communities would really suffer, but local communities would still have to provide that support.
Finally, Mr. Secretary, I've long been a strong supporter of improving access to quality, affordable child care. I don't think extending pandemic subsidies is the way to do that. Instead, I've focused on expanding the Child Care Development Block Grant Program. We increased funding last year by 30%. This year's under Senator Capito and Senator Schatz, we've increased, Senator Baldwin, we've increased the funding by another 9%. Wouldn't it be better to invest additional child care funds in a program that directly helps subsidize child care costs for low-income families?
Senator, my staff can be in your office immediately after this hearing if you'd like to discuss how we get there, because you're absolutely right. We need a long-term solution. I think most everyone sitting at the dais would say that. But while we get to that long-term solution, we need something for those small businesses that are going to close tomorrow. We need something for those parents who are looking for a quality child care service today. And without the stabilization funds, we will lose ground, we will lose businesses, we will lose families having care for their kids.
Thank you.
Senator Durbin.
Your questions.
Thank you very much to both of our witnesses this morning. We will now begin a round of 5-minute questions of our witnesses, and I ask my colleagues to keep track of your clock and stay within those 5 minutes. Secretary Becerra, as I talked about in my opening remarks, we have a child care crisis in this country, and it is an economic crisis that is really worsening. When the pandemic hit and the child care sector was pushed to the verge of collapse, Congress recognized the need to act, and we delivered the stabilization funding to make sure those programs could stay open and keep prices down and continue serving our families. It worked. And the stabilization program provided funding in 8 to 10 licensed child care programs across the country and to nearly 7,000 programs just in my home state of Washington, and served nearly 10 million children nationwide. But that funding expired September 30th. And unless we take action, more parents are going to be forced out of the workplace, small businesses are going to be left without the employees they need, and families, along with our entire economy, are really going to feel the consequences. So it's important that the administration has requested this funding to continue to stabilize the child care system. Can you talk to us about the consequences that it would be to working families and our economy if we fail to extend this funding?
Absolutely, Madam Chair. And again, thank you for all the work that you and your colleagues have done to place us where we are today with funds like the stabilization funds that you passed in, last year. It's just in the definition of the word. If we don't have those stabilization funds, we destabilize not just families across America, but our economy. Because there will be people who have to leave the workforce because they'll have to stay home to care for their kids. There are small businesses. The vast majority of our child care programs are small businesses. They will go under. There are people who are already telling us that they relied on the stabilization funds to be able to increase wages for their workers so that they wouldn't leave. Remember, they're competing against the fast food shops, the Walmarts of the world, who pay more in many cases than they do. They were able to increase wages a bit to try to keep those workers who prefer to care for kids. It would be devastating. There is no doubt that Americans would lose not only income, but opportunities for their kids, and we would lose a lot of small businesses in America.
Thank you. And another one of my top priorities is the fentanyl crisis. And just last year, there were nearly 110,000 drug overdose deaths, fueled in large part by fentanyl. In Washington State, fentanyl is driving the increasing rate of overdose deaths among children and teens. Making sure synthetic opioids like fentanyl do not cross our borders is really important, and I know the administration is focused on this. It ramped up its efforts and conducted successful operations that have resulted in an additional 10,000 pounds of fentanyl seized over a 2-month period. That's roughly a 17% increase above the preceding months. But seizing those drugs alone will not solve the problem for communities that are really ravaged by this crisis. Secretary Becerra, I'll start with you, and then to you, Secretary Mayorkas. Talk to us how about additional funding through the HHS will address the harm our communities are facing.
Madam Chair, there's not a state or not a community in America that doesn't need more assistance to tackle the opioid crisis, now driven mostly by fentanyl. Some 70% of these overdoses as a result of opioids are really now driven by fentanyl. We need to do much more, they will tell you. We can help with the prevention and the treatment. Secretary Mayorkas, I know we'll talk about the interdiction, but without the help, we're going to lose Americans. We know it, and we're doing everything we can for making naloxone more available to people to save lives, but also working with those on the ground who've been saving lives from day one. We want them to have the resources they need.
Thank you. And Secretary Mayorkas, what will the President's supplemental request allow you to do to stop fentanyl from entering our country?
Chair Murray, it will assist us significantly in our interdiction efforts. We already have done an extraordinary job. The men and women of U.S. Customs and Border Protection and Homeland Security investigations have engaged in a number of operations, Operation Blue Lotus, Operation Artemis, which is surging our personnel and our technological resources to the ports of entry where the majority of the fentanyl is smuggled into our country. We are working with our international partners. The $1.3 billion that the supplemental request calls for will assist us with additional personnel, additional technological resources, and the ability to work with our international partners to really drive an encompassing approach to our interdiction efforts.
Thank you. Vice Chair Collins.
Thank you, Madam Chair. Secretary Mayorkas, you mentioned that it had been since 1996 since Congress passed comprehensive immigration reform. The supplemental request includes funding to help strengthen